Thank you and welcome to the show this morning. The topic this morning is the Center for Health Research at Tennessee State University, and we're fortunate to have with us to talk about this very, very important center at Tennessee State University, Dr. BHusaini, who is the director of the Center for Health Research at Tennessee State University. And of course, Dr. Hussaini, let me welcome you to the show this morning and tell you how delighted we are to have you with us.
Well, thank you, Dr. Haney.
Good.
It is a pleasure to be here.
Very good. You know, Dr. Hussaini, let's give our audience an opportunity to know something about you by having you to talk about your background, your education, and some of the things that eventually led you to the directorship of the Center for Health Research at Tennessee State University, and then we'll talk about other things.
Well, to begin with, I am by training a psychiatric epidemiologist. I was trained at Wayne State University in Detroit, Michigan. And it was in 1972 when I finished up, did a couple of studies there, one study on schizophrenia patients and another study on emotionally disturbed children on Highland Park school system. And when I completed those studies, my chairman at that department said, you should go to Tennessee State University. They are looking for somebody of your caliber to develop research program. So I came. I was tired of shoveling snow in Michigan just to get out of my driveway. So when this opportunity came along, I said, sure. I have never been to Nashville before at that time, and it was a wonderful experience when I saw the tall trees in the middle of winter. And I said, oh, the leaves are here, the grass is still there. That's very good. It was the month of April when I arrived to interview, and I joined in September of 1973. So I've been here since then. Okay, since 73. Since 73, which is a very long time. So that tells you that I have spent half of my life at Tennessee State University developing this Center for Health Research, developing a research program and set of activities for our faculty and for our students, and developing our collaborative ties with not only with other academic people, but also with the community where TSU is located. So in a real sense, being the director of the center, you in reality created, in a real sense, I created the Center for Health Research in 1976 with my first federal grant to look at the health needs of 9 counties in Middle Tennessee. 9 counties around Davidson County. And that work led to other grants that started to come in. People from other states started to ask me to help them to do studies, and I did studies in rural Ohio, in rural Oklahoma, helping those people to assess their health and mental health needs, and how the services, if there are any, being provided to the people who need such help. And so the center that you created, in a real sense, had not only regional impact, but it also had some national implications in terms of a large number of things that you were doing. Very, very much so. If you look at our mission, which of the center, which I established, as I said, in 1976, you will find that our first mission is to improve health outcome and reduce health and ethnic, racial and ethnic health disparities. Very good. That is mission number 1. Second mission is to train our junior faculty and students in conducting health research and which can contribute toward developing new policies, health policies, both at the local, state, and national level, which has to be based upon evidence. What is the evidence that is coming? So that's why we are doing research. Okay?
And so the whole foundation will be laid around this, around research. You're more concerned about the research in reference to these issues than anything else.
Exactly, it is. So if you look at where we have concentrated, in fact, if you look at the areas where we have concentrated, there are essentially 4 areas that we have
We're going to have to interrupt here, Doctor, for our first commercial break, after which time we'll come back and have you give you an opportunity to elaborate upon that. And we'll be back with our audience following this very, very short commercial break. We're talking to Dr.